The most common similarity between the two approaches that we learned about this week, solution-focused brief therapy and narrative therapy, are that they are both considered postmodern approaches to therapy, meaning that they really value a sociocultural perspective, which is also considered a strength of both of these approaches. They are similar in that they're both more focused on the present and the future. But the most notable difference between the two therapies is that solution-focused brief therapy is not really interested in how the issue came to be or affirming a diagnosis of any kind, but it's really rather solely focused on solutions for the client and the person. What is and isn't working for that person, and how can the client and the counselor work together to help resolve those issues for the client. And so a strength of this approach is that there are many techniques that can be used to help the client find solutions that work for them and their life. And they are seen as the experts of their own life. Narrative therapy, however, it does seek to investigate how the issues came about in a person's life, and it calls for evidence from the person to acknowledge, evidence on their problems. It involves encouraging the client to share their experiences in their life with the counselor, and it ultimately as well, though, does use techniques to help the clients almost re-author their life in a way that helps them. It seeks to affirm to the client that they are not their problem, that the problem is the problem. And so a strength of this approach would be that it believes in the client's ability to be the author of their own life and focus on perception, which I can appreciate. A weakness of both of these therapies is that postmodern therapists really want the client to feel as though they know themselves the best and are seen as the experts in their own life, and ultimately the therapists just help facilitate that. But some clients may feel as though this makes the counselor untrustworthy to do their job, or what is their job then? But ultimately it's up to the counselor to convey to the client that they are the experts in therapy, but the person is the expert in what they want for their life. And all of these things were noted by Corey 2021 this week. He really explained both of these theories in great detail, very well. Biblically, as mentioned by Ton, these postmodern therapies are compatible in that there is capacity for change in the person. And however, though, they do not adequately acknowledge, perhaps, though, that we all fall short of the glory of God, and that inevitably that will happen in a person's life because we are fallen beings. So I think ultimately within the frame and the context of these two therapies, it values what is important to the client. And so ultimately, I believe that if faith is important to the client because these theories have an aim to be sociocultural and acknowledge that the client is the author and expert in their life, faith can easily be integrated into these therapies. I will say perhaps it leans too much on the person itself and not enough on God when looking at these theories. But as stated, I do feel like compatibility wise, if faith is important to the client and it is a part of their reality, I believe that it can be integrated.